Some know ketamine as a tranquilizer used by veterinarians, while others recognize it as the party drug called Special K.
The FDA recently approved ketamine for people with a form of depression that is resistant to traditional antidepressants. Emergency room nurse and clinical nurse specialist Alice Benjamin joins us with more details about this new ketamine nasal spray. Good morning.
Good morning.
What is treatment-resistant depression and how many people suffer from it?
Right. So when it comes to depression, it's important for people to know that this is the #1 disability in the United States. Over 16 million people have and live with depression, but up to 1/3 have treatment-resistant depression. And what that means is these are people who have had little to no benefit from traditional and standard medications for their depression.
Right.
And this is a very serious and life-threatening condition because if left untreated, this actually increases their risk for suicide.
And now there's a new nasal spray. How does it work?
So there's a new nasal spray. It's called Spravato, and it's actually a derivative of ketamine. And it's very different from the traditional antidepressants in the fact that it's actually inhaled. What people may not know is that your nose is a very vascular area. So outside of getting medications from an IV, your nose is a place that you can absorb medication very quickly. And it works directly on the neurotransmitter glutamate, unlike other medications. So when someone takes this medication, they literally can experience a boost in mood in as little as an hour.
Now, are there major concerns or side effects with ketamine in this form?
Yes, absolutely. So ketamine, there's a high risk for abuse and misuse. There is sedation, dizziness, a dissociation. You'll feel dissociated from your feelings, your thoughts, and your body. And for a small group of people, this actually may increase their thoughts of suicide and suicidal behavior. So it's very important with this medication that it's administered at a Spravato approved location. Patients need to stay there for at least 2 hours.
So it's not something you would take home?
Oh, no. This is not your albuterol where you're taking it at home and taking it as needed. This medication has very strict guidelines. It is administered in a hospital setting. You go to your provider, you get the medication, it's administered to you, and they have to watch you for at least 2 hours, and they have to document your how you're feeling in a registry, and you're not allowed to drive for the remainder of the day because, the sedation risk of this is high, and we really don't want to. We want to make sure that people are safe with this.
So to be clear, you're not going to go to the doctor and say, I want this new nasal spray to treat my depression.
No.
You're not getting that.
No. So the people who are candidates for this medication are people who have tried at least 2 lines of medication for their depression and have been unsuccessful with this. So you had to have tried, counseling, medication, and other therapies. And when that's not successful, then your doctor will determine if you're a candidate for this next medication.
But then it's administered in the hospital, or then you can get it?
Well, you're eligible for a prescription, but there are only special providers. Not every doctor can administer this.
I see.
There are only special providers that have this authority to prescribe this medication, and they then also have to monitor you very, very closely.
What are some of the early results from this, from those who have used it and it's worked?
Right. So there were some short-term and long-term studies that looked at 1,700 people with this resistant depression, and I have to be honest, the FDA laxed its rules a little bit. Usually the outcomes need to be a lot more stringent, a lot higher, and in this case, 51% of people who used the Spravato had reported improvement in their depression and had for a longer time compared to people who were on traditional medication. So you're thinking only 51%, but if you're at this level, or at this point where other medications, other therapies have not been successful and it increases your risk for suicide, this is definitely something that we are still going to offer you, even if there's only a 51% chance. Again, the studies had better outcomes than negative effects.
Okay. Alice Benjamin is an emergency room RN and clinical nurse specialist. You can follow her on social media and check out her website right there, asknursealice.com.
Thank you.
Thank you.
All right, still ahead, a wild